Difference between XE, XU, XP and XS modifiers with examples in medical coding. In medical coding, the XE, XU, XP, and XS modifiers are used to provide additional information. Here is a breakdown of each modifier and examples of when they may be used. 1. XE modifier, separate encounter. The XE modifier is used when a procedure or service is performed on the same patient, by the same physician or other qualified healthcare professional, but during a separate encounter or visit. This modifier indicates that the procedure or service is distinct and separate from other services provided on the same day. Example: a patient visits a dermatologist for a skin biopsy on Monday and returns on Wednesday for a separate visit to have a mole removed. The XE modifier would be used to indicate that the mole removal was performed during a separate encounter. 2. XU modifier, unusual non-overlapping service. The XU modifier is used when a procedure or service is performed by a different physician or other qualified healthcare professional than expected for the specific procedure or service. This modifier indicates that the service provided is unusual or unexpected for the specialty of the physician or healthcare professional. Example: a patient with a heart condition visits a cardiologist for a routine checkup. During the visit, the cardiologist also performs a minor skin biopsy. Since a skin biopsy is not typically performed by a cardiologist, the XU modifier would be used to indicate that the service provided is unusual for the specialty. 3. XP modifier, separate practitioner. The XP modifier is used when a procedure or service is performed by a different physician or other qualified healthcare professional than expected for the specific procedure or service, but during the same encounter or visit. This modifier indicates that the service provided is distinct and separate from the primary physician's or healthcare professional's services. Example: a patient visits an orthopedic surgeon for a knee replacement surgery. During the surgery, a general surgeon is called in to assist with a complication. The XP modifier would be used to indicate that the general surgeon's services were separate from the orthopedic surgeon's services during the same encounter. 4. XS modifier, separate structure. The XS modifier is used when a procedure or service is performed on a separate organ or structure from the primary procedure. This modifier indicates that the service provided is distinct and separate from the primary procedure. Example: a patient undergoes a colonoscopy for polyp removal. During the same encounter, a separate procedure is performed to remove a skin lesion. The XS modifier would be used to indicate that the skin lesion removal was performed on a separate structure from the colonoscopy. It is important to note that the use of these modifiers may vary depending on the specific coding guidelines and payer requirements. It is always recommended to consult the official coding guidelines and payer policies for accurate and appropriate use of modifiers.